Good morning, ladies and gentlemen. It's Annalise Garrison, and I would invite those of you who I do not tutor as of yet, please watch this video, and I invite you to call me and see if I can help you in the same way that I've helped many students before. I have been teaching the NCLEX since 1997 and have a very good success rate. With the current group of people that I'm tutoring, I noticed that I needed to put a video out there for you on how to answer the priority questions. Because you have a unnecessary fear of, who should I see first, what should take priority. If we change our way of thinking, these questions can become easier to answer as we go through our journey of passing the NCLEX together. What I'd like to say this morning to you all is the NCLEX either asks you to pick a correct answer or to pick an incorrect answer. And this will become more clear as this presentation rolls along. So there's two types of questions. I'm going to go over right now when you should know to pick the correct answer. If there's more than one correct answer, then pick the best answer. Now, the NCLEX will ask a question. How do you know whether to pick a correct answer or an incorrect answer? Well, in order to pick a correct answer, the word correct will be in the question. The word first will be in the question. The word prioritize will be in the question. The word indicate, the word implement, the word initiate, all of these words will be cues that you should know that you're looking for a correct answer. The words best and should and important will be seen in mid-level questions. These are questions that are asked to you by the NCLEX that you should have learned in school. And that's the word best, the word should, and the word important. So let me give you some examples about when you know to pick a correct answer versus an incorrect answer. Look at this type of question. The nurse has attended a staff education conference about infection control precautions. Which of the following statements by the nurse would indicate a correct understanding of the teaching? So when you look at the four choices, you want to pick a statement, an intervention, an assessment that is correct, right? Here's another example. The nurse on a women's health unit has just received report on the following four clients. The nurse should plan to first assess the client who. So you see, this is a priority question, but it has the word first in it. So you know to pick a correct answer. All right? Or the question could be like this. The charge nurse in a long-term care facility is observing a client who has had 3 falls during the past 2 days, sitting in a wheelchair with restraints in place. The facility has a restraint-free policy. Which of the following actions should the nurse take first? Now, for those of you who I am tutoring, I told you that every facility has a restraint-free policy. Every facility. You cannot just slap restraints on someone, whether they're chemical or mechanical, just for the convenience of it. So, every facility has a restraint-free policy. What we want to look at here is, this person has fallen in 3 times in the past 2 days. So what would we do first? Well, this client is in a wheelchair with restraints. Perhaps they should be in restraints. If they become a danger to self or others, we are allowed to restrain them. If she gets up and keeps falling, we are allowed to restrain them. But then we must call the physician and ask for a telephone verbal order for that restraint if the physician could not order the restraint on the spot, right? I told those of you who I was tutoring that. So this is a example of picking a priority question out, a correct answer, because of the word first. So we've seen two examples. We've seen the use of the word correct, and we've seen the use of the word first. We know the NCLEX is asking us to pick a correct answer. Don't think of it as a priority question, right? Think of it as a correct answer. If there's two or more answers that can be correct, then pick the best answer. We could have the actual word prioritize. That would make it a priority question, right? So let's look at this example. The nurse is assigned as a preceptor to a newly hired nurse. Now, let me stop right there. For those of you who I am tutoring, and I invite others of you to sign up for my tutoring, it does not matter whether the nurse is a newly hired nurse or whether she's been there for 15 years. A newly hired nurse can do everything that a LPN can do and that an RN can do. It's just that we're precepting them. It's just that we're orientating them to our facility, to our policies, to our procedures. All right? So don't get confused when the NCLEX asks you about a newly hired nurse. That newly hired nurse can do everything that a 15-year nurse can do, or a 5-year nurse, whatever the case may be. So don't let that trip you up, guys. Which of the following, if performed by the newly hired nurse, would indicate his or her ability to prioritize? So pick the answer that the 5-year-old nurse would do, that the 15-year-old nurse would do, that the year-old nurse would do. There's no difference. It makes no difference whether she's been there a while, he or she has been there for a while, or whether they're newly hired. You notice we're picking a correct answer because of the word prioritize. And you will also see prioritize when you're looking for an incorrect answer. Again, I'm going to explain that. Let's look at this example. The nurse is preparing a staff education conference about insulin therapy. Which of the following information should the nurse include? So we're looking for a correct understanding. We're looking for a correct statement. We're looking for a correct intervention, right? Because of the word include. So we want to pick a correct answer. The word include can also be used in this type of question. The nurse is developing a care plan for a diabetic. Which of the following should be included in the care plan? So this word makes us understand that we're picking a priority answer that is a correct answer. All right? The NCLEX also uses the word implement. When you see the word implement, we're looking for a correct statement. We're looking for a correct assessment. We're looking for a correct intervention. Something that is correct. Let's look at this example. The nurse is caring for a client with C. diff. Which of the following infection control precautions should the nurse implement? Now, the word implement should tip you off that you are looking for a correct statement, a correct intervention, a correct assessment, right? I know that I said the word best, should, and important are used for mid-level questions, and should is often seen with content type questions. That's what I'm saying. The content is, to me, is the things that you should have learned in school. I'm really big on teaching concepts because you can get content from your old nursing books. You could get content from Kaplan. You can get content from Googling it. You can get content from Hearst. You can get content from any other review out there. My main focus is concepts, and that's where we go wrong. People can always narrow the question down to 2 answers, and then they don't understand how to pick the right answer. That's why you want me to tutor you. I'm excellent in that area. And for those of you that I am tutoring and you're watching this video, you're doing a great job. And keep up the good work. Let's look at another example of how to pick a correct answer when answering priority or even delegation, right? Delegation and priority go together, right? So, let's look at this example. The nurse is caring for the following clients. It would be a priority to initiate a referral to a social worker for A. Now, when you're asked a question like this, it's important to understand for the NCLEX that you pick the correct answer that has to do with the scope of practice for whatever department you're making the referral to. In other words, for this type of question, pick the correct answer that would be in the scope of practice, not for you, not you the nurse, but for that social worker. If this would have said it would be a priority to initiate a referral to a nutritionalist, well then pick the correct answer that is in the scope of practice for the nutritionalist. Alright? You're not necessarily doing the referral. You have these clients who need a social worker, who need a nutritionalist, who need a physical therapist. Whatever the case may be, pick the answer that's in that person's scope of practice. Let's look at another example of a word question here. The nurse is caring for the following clients. It would be a priority for the nurse to initiate a multidisciplinary conference for, right? So the word, and when we see the word initiate, we know to pick a correct answer for that question versus a incorrect answer. Now, I've been talking about correct answers versus incorrect answers. Well, as I said, the NCLEX will ask 2 types of questions. You're looking for a correct answer or an incorrect answer, right? So we know that we're looking for something that's incorrect, where we are looking for an incorrect intervention, an incorrect statement, an incorrect assessment. Whatever the case may be, we know we're looking for something incorrect in our answer when we see these following words. And again, if you get tutoring from me, I will tutor via Skype. So it doesn't matter where you are in the world. We can connect anywhere on the globe via Skype, and that's the wonderful thing. So any of you that want tutoring, please do. So we know we're looking for an incorrect answer when we see the words follow up, when we see the words immediate, when we see the word clarify, when we see the word risk, when we see the word notify, and when we see the word intervene. Now often, ladies and gentlemen, we often can narrow it down to 2 types of 2 correct answers, right? Or 2 incorrect answers that will be correct. You'll understand this better if you get tutoring from me. So, if more than one answer can be incorrect, thereby making it a correct answer for the NCLEX, then you want to pick the worst. Now, what will help you a lot, and I'm not going to put it here, are my concepts. I did make a video of 8 essential concepts, but those of you who are receiving tutoring from me and watching this video as part of your homework to prepare for our session, you know that I now have, 20 plus concepts. So those concepts will help you with these types of questions, whether you're picking a correct answer or an incorrect answer. You have to use my concepts in correlation of this little video. So let's look at some examples of some questions that use these types of words that we know that the incorrect answer will be the correct answer for the NCLEX. Alright, let's look at our first example. The nurse is preparing to administer prescribed lithium to a client. Which of the following would require follow-up before administering the medication? This means that we are looking for an incorrect answer because of the word follow-up, we know that the incorrect answer or the incorrect, whatever it might be presenting, the incorrect assessment, the incorrect statement, the incorrect intervention, something needs to be followed up. So the incorrect answer would be correct. Look at this example. The nurse is assessing a 72-year-old client with a blood pressure of 182/92. Which of the following findings would be a priority to follow up? The word follow up shows us that we're looking for an incorrect answer, an incorrect intervention, right? Something incorrect. That will require follow-up. So that incorrect answer will be the correct answer on the NCLEX. Another example. The nurse is observing a staff member caring for assigned clients. It would require immediate attention if a staff member is observed. So that word immediate means we're looking for an incorrect answer because that incorrect action by that staff member will cause this incorrect action to take priority. So we have to immediately intervene before this staff member makes a mistake. So the incorrect action by the staff member would be the answer for the NCLEX. We're looking for something incorrect because of the word immediate. Look at this example. The nurse is assessing a client with botulism. Which of the following findings would require immediate follow-up? So again, we have the word follow-up, but we also have the word immediate in here, right? So what incorrect symptom? What is the worst symptom, okay, if there's two? What would require immediate attention, all right? What would require immediate follow-up? You see, all of these questions are priority, whether we're looking for an incorrect answer or a correct answer. Just put these 12 words, 6 words for correct, 6 words for incorrect, into your mind, and you will view delegation and priority questions much simpler on the NCLEX. You won't get that anxiety, you know? All right, look at this example with the word clarify, right? The nurse is reviewing new prescriptions for assigned clients. Which of the following prescription should the nurse clarify? So we're looking for something that is wrong. The wrong answer will be correct for the NCLEX. Because of the word clarify, it does mean we have to call the physician. There's only 3 times you call the physician, and those of you who I'm tutoring, think right now, what are the 3 times I said to call the physician? And one of those times was to clarify an order. And this question is an example of one of those times. All right, let's look at the word risk. All right. The nurse is caring for the following clients in the telemetry unit. Looking at the following ECG strips, which client is at highest risk for a stroke? Those of you who I'm tutoring, you have you have watched my EKG video. I want to, if the NCLEX gives you 4 strips, and it says, like a question like this, which client is at highest risk? Right away, look for something ventricle. I don't want to make a whole song and dance about EKG strips. I already made a video about that, right guys? So look for something ventricles. Listen, I have tutored people for the NCLEX and they have passed their NCLEX and they have worked on telemetry units. The telemetry unit will send you for further training. That's not my goal here. My goal is to teach you the types of different strips to recognize on the NCLEX, which is on my EKG video. For those of you who are watching this for the first time and don't know what I'm talking about as far as homework goes, go ahead and feel free to look up that video, okay? But this is the point I'm making. When the NCLEX gives you 4 strips, always look for something ventricle. Simply put, if we think about it, the ventricles are larger than the atria. So if anything goes wrong with the ventricles, that will throw the individual into a possible MI or stroke or some other kind of difficulty, right? Anything that's wrong with the atria can be mostly controlled with medication. But if something goes wrong with the ventricles, that they will need defibrillation. They may need a pacemaker if they had a stroke or a CVA, right? So think of it like that. Don't make everything so complicated. Don't make everything so complicated, and then that way you don't have to be like worried so much about the NCLEX. The NCLEX is really easy, and it all boils down to understanding how to pick a correct answer for the NCLEX, and also understanding when to know that an incorrect answer is a correct answer. So I hope you get tutoring from me, because this is kind of a hard concept to understand. Alright, let me give you another example. The nurse is assessing assigned clients. Which of the following should the nurse assess for being at highest risk for suicide? Right? So the word risk means somebody or something in that answer is incorrect, putting them at highest risk, right? So pick the incorrect answer. That will be correct for the NCLEX. When you see the word risk, we're looking for an incorrect answer. When you see the word notify, look, we might have an example like this. The nurse has just received report on the following clients. What finding by a nurse prompts the nurse to notify the physician? The word notify, something is wrong, so the incorrect answer will be correct for the NCLEX. Notify may also take this form. The nurse is caring for a client with Hashimoto's disease. The nurse will notify the physician if the client states. Here, we're looking for an incorrect statement by the client. If the client says something incorrect about Hashimoto's disease, they obviously don't have their information correct. So we need to notify the physician that this patient needs more education about Hashimoto's disease, right? So look for something the client says wrong. That will be the correct choice on the NCLEX. So we know we're looking for an incorrect answer when we see the word intervene. Look at this example. The nurse is assigned as preceptor for a newly hired nurse. Again, remember what I said about that newly hired nurse. That newly hired nurse can do everything that a seasoned employee can do. So the fact that they're newly hired, don't worry about it. Pay attention to what it's asking. What action by the new nurse would cause the preceptor to intervene? What is the newly hired nurse doing wrong? That incorrect action will be the correct answer on the NCLEX. So this isn't as hard as it seems, is it, when answering priority questions? We just need to change our frame of mind. Just need to relax and change your frame of mind. The home health nurse is visiting a client with leukemia. who has received prescribed chemotherapy to observe the spouse performing client care. Which of the following actions by the spouse would cause the nurse to intervene? So we're looking for something, maybe a problem that the spouse is having, right? Or maybe a problem that the spouse is doing wrong, right? Obviously, the spouse may need some intervention. They may need more education, right? By the way, I just want to, digress just for a minute and say, when the NCLEX asks you questions about the spouse or any kind of caregiver, whether it says the mother came into the clinic with a 2-year-old child, whether it says the spouse is caring for the 92-year-old with leukemia, whatever the case may be, you want to pick the answer that includes both the spousal needs, the caregiver's needs, and the child, and the client. Let's just say the client, whether it be a child or a 92-year-old client, or the 92-year-old spouse with leukemia, right? Include the answer that has both the client and the spouse, or the child and the mother, whatever the case may be. So if you would like help preparing for the NCLEX online, contact me today at the number on my website. So go to caringforyou.net and click on Contact Us, send me an email, write me an email, call me on my cell phone. I'm more than happy to answer phone calls or emails. Try not to text me though. I don't really like texts. And also, don't add me to Skype until I give you the information in the email on how to add me to Skype. That way I won't get overloaded. I won't get you confused. I mean, like right now I'm tutoring 2 Annies, and then I have 2 Annies on Skype that I don't tutor at all. And that's because they added me. I really keep the caringforyou.net Skype account for tutoring. So I do texts, but I don't really like them because I have to look at them on my cell phone. So it's best to either call me or send me an email, and I will definitely do what I can do for you. All right. God bless, and I hope to continue helping those of you who I am tutoring, and hopefully I'll see some of you in the future.